Greetings, everybody. I hope you are well and that you are comfortable. My name is Shanaz Davids, and I am with an organization called Test Learning Center. At Test, we have been mandated by the Department of Basic Education to provide you with the necessary information and tools so that you are able to go back and assist or draft the new HIV, STI, and tuberculosis policy for your school. I'll be doing a presentation with you guys, so please make notes as we go along. At the end of every section, please write down as many questions as you have. We'll do this as far as possible in detail, but should there be any questions that you have, we are having a face-to-face session, a virtual face-to-face session next week, the 20th, and you'll be able then to pose your questions. Make notes as we go along, as some of the information is very important, and it will also guide and assist you. I also provide you with certain tips that you can use for yourself, and not just in the sense of writing this policy, but on a personal level as well. So shall we get started? Everybody's comfortable, pen in hand. Let's start sharing our first screen. All right. We're now going to start with the new HIV, AIDS, STI, and tuberculosis policy drafting. This is Department of Basic Education Training 2017-2018. Now, in terms of our outcomes, I need you all to be extremely open-minded with regard to this policy. You need to revisit your own prejudice when it forms part of writing this policy. I am a firm believer that prejudice has no place within our education department. Your SGBs have had training in governance and ethics responsibility. So they come to the table already open-minded and already having revisited their own prejudices, and they do know that that needs to be kept aside from their actual tasks when it comes to writing a policy. Please note that this policy is extremely challenging, especially if you cannot be open-minded or you are still sitting with certain prejudices. Right, let's move on. Let's do awareness. Let's do a bit of awareness with regard to HIV, STI, tuberculosis, as well as COVID-19 in South Africa. I prefer in giving you guys some shocking information, hence this slide. Did you know that globally, for every 100 people infected with HIV/AIDS, only infected with HIV, 17 of them is in South Africa. Is that sinking in? For every 100 globally, 17 of them are in South Africa. South Africa is also home to the largest ART program in the world. ART stands for antiretroviral treatment. We currently in South Africa have 4.3 million people on ARTs. And those are only the people that we know of that are infected with HIV. We have also noted that the level of HIV knowledge amongst our 15 to 24-year-old age group have declined over the years. Hence, our new infection rates are so high amongst them. We're looking at an estimated 2,000 new HIV infections per week in that age group. Is that not shocking? Is that absolutely not shocking? 2,000 new cases, age group 15 to 24. I tell you, that scares me. So if you think about it, if you have siblings or family members, cousins, aunts, children even in that age group, they are in extreme danger. So it's time for us to up our game in terms of HIV. HIV and tuberculosis constitutes a major management challenge within the Department of Basic Education. And when I say management challenge, it's because HIV has not been managed over all these years that we are currently sitting with the figures that we do today. Now, when you look at our schooling system, Both infected and affected learners are negatively disadvantaged because of HIV. 10% of our enrolled learners within the Department of Basic Education are actually orphans because of HIV. I've given you a few factors and I want you to think about it. The 17 out of 100, the 15 to 24 age group, 2,000 new cases, and the biggest shocker of them all is the fact that these new infections are amongst young girls and women between those ages. So pay careful attention when we are dealing with any type of infection. When it comes to HIV, it's our young women and young girls that are extremely at a disadvantage because they are the ones that are being infected on a daily basis. Now, let's look at AIDS. What is AIDS? A, the meaning AIDS stands for Acquired Immune Deficiency Syndrome. Acquired means you have to do something to be able to get that disease. You can't just get AIDS. AIDS doesn't just, somebody coughs in your direction and you get AIDS. It's a virus that attacks your immune system. And your immune system then becomes deficient or weak that it cannot fight off other diseases. Therefore, we have syndrome at the end, AIDS, acquired immune deficiency syndrome. Your body is now open and susceptible to any and all viruses because your immune system has been compromised. Do know that there's a big difference between having HIV or being HIV positive and then having AIDS. You can't have AIDS unless you've had HIV. Now, in order for you to get AIDS, while you have had HIV, you have still been not safe. In the sense of not going on an ART program, as an example, not living a good and healthy lifestyle. Now remember, even if you are HIV positive, you can still live a normal, healthy life, provided that you are on your ARTs, you eat healthy meals, rest enough, and do minimum forms of exercise. If you do not take your ARTs, the other three is not going to work for you at all. You will then end up with a condition called full-blown AIDS. And this, my dear learners, is the point where there is no return. Because pretty soon you will be infected with an AIDS-related illness, such as tuberculosis or pneumonia. So when you have HIV, you can recover. When you have AIDS, my apologies, when you have HIV, you can live a normal, healthy life. But when you have AIDS, the writing is on the wall for you. So it's important for us to know the facts and know what is happening around us for us to be able to pass this information over effectively. Now, how do you think HIV is transmitted? Clearly not by kissing, hugging, or sneezing in somebody's direction, or even sharing a cup or a saucer or a teaspoon. Not even a mosquito can give you HIV. HIV is only transmitted by bodily fluids. I'm going to say that again, bodily fluids. And how does bodily fluids get into our system? Through unprotected sex, having a blood transfusion with HIV infected blood, which is extremely rare in South Africa, because anybody that donates blood, that blood is tested, retested, and tested again to ensure that it is free from any and all radicals. Then also the sharing of needles. When a drug addict that injects himself regularly with drugs is HIV positive, and he shares his needle with somebody that's not positive, chances of that person becoming infected is huge. So it's best, should you be on drugs, that you do not share your needles or even your razor blades. Then we look at our community caregivers. Sometimes they get needle stick injuries. And when a needle pricks you, a needle from somebody that has HIV, you too can contract the virus. Then we have the mother-to-child transmission. When a HIV mother is lactating her baby, when she is breastfeeding, she can transfer the disease, the germ, the disease into her child. Now, that is only if she is not on ARVs. When a HIV positive mother gives birth to a baby and that mother is not on ARVs, she is then also able to transmit that disease to her child. Do you understand that? Today, we have evolved medically so much that when an HIV positive person becomes pregnant and that person is on her ARVs, she does not transmit the disease to her child. Children are born today free of HIV to HIV positive mothers. Then, of course, we have the most hated side of HIV transmission in adults and children, and that is through child abuse. Something that we do not cover in this section, but I'm sure you all know what we are talking about. At this point, if you have any questions with regard to HIV, please write them down so that we can discuss it next week. Let's move on. Tuberculosis. You've all heard of TB. Everybody calls it TB. Nobody refers to it as tuberculosis. What is tuberculosis? TB is a disease that is caused by a germ or an organism called Mycobacterium tuberculosis and is commonly referred to as MTB. This germ is so small, you cannot see it with your naked eye. You need a microscope to see it. It is very difficult to get rid of the TB germ. Very difficult to get rid of the TB germ. It has a thick, waxy outer layer, and here's the thing. It can survive in the air for up to 5 hours. TB thrives in dark and damp places. Absolutely thrives in dark and damp places. That's why it's important to have open windows and let the sun come into your living spaces. Sunlight is TB's worst nightmare because sunlight kills the TB germ. Now, when the TB germ is breathed in, it grows in the lungs, okay? And that makes holes in the lungs. And if it goes untreated, it can spread to other parts of the body. Also bearing in mind that anybody that has got tuberculosis or has been infected with tuberculosis and does not go for their treatment, they are contagious. Let's move on. Remember earlier we said TB remains in the air for up to 5 hours because it is airborne. It means that TB is breathed out by somebody that's infected with the disease. And this germ stays in the air, and other people with a compromised immune system breathe that in, will definitely be infected. If you do not have a compromised immune system, chances are it won't bother you. Now, TB usually affects the lungs, but more often than not, it also affects other parts of the body, especially if it goes untreated. It affects parts like your lymph nodes, which are your glands. It can also affect your bones as well as your brain. Yes, absolutely, it can. Tuberculosis grows very slowly, and even though many people are infected with it, the disease only develops and grows in people whose immune system is too weak to fight it off. Remember what I said? People with compromised immune systems. Now, TB of the lungs we refer to as pulmonary tuberculosis, also PTB. And this is very infectious, more so when the person is not on treatment. It can spread to other people, and those people too, if they have a compromised immune system, will get sick. Then earlier we mentioned TB of other parts of the body outside of the lungs. These are called extrapulmonary TB or EPTB. This kind of TB can affect the lining of your lungs. Remember, not your lungs, the lining also referred to as the pleura. It can infect your lymph nodes, your spine, joints, kidneys, brain, and even your skin. Tuberculosis can infect any part of your body. This type of TB is not infectious. It can be passed on from one person to another. Sorry, my apologies. It is not infectious, which means it cannot be passed on from one person to another. The only infectious tuberculosis is the one that's in your lungs. If a person gets tuberculosis, they can die if they do not take their medicines as prescribed. Now remember, tuberculosis is a curable disease, provided you go on your treatment and do not get off it until you get the okay from your healthcare provider. What happens when you go off your tuberculosis medication? What happens when it goes, or you go off your tuberculosis medication? You now become drug resistant, which means the medication isn't going to work for you anymore because the germ within your body has now evolved. It has mutated. And now you need a different type of medication. You are now multi-drug resistant. But because you already have the history of going on your medication and off your medication when you're feeling better, these drugs no longer work. There are two types of TB that are drug resistant. One is the multi-drug resistant TB, and this is resistant to the TB medicines, the antibiotics, as well as the isoniazid and the rifamycin. My apologies. It's so difficult to pronounce these words. But know that it is two medications that you are now resistant to. Now, if you do not take your medication and you keep going on again, off again, you will pretty soon end up being extensively drug resistant, which means none of the medication will help you. Medications that they can give you can make you comfortable, but you, having not taken your treatment as prescribed by your healthcare professional, have signed your own death certificate, because there is no coming back from an extensively drug-resistant TB. Anybody can get tuberculosis. There is so much of stigma attached to tuberculosis. People are under the impression that only poor people get TB, contract the virus, the disease. They are under the impression that only unhealthy and unhygienic people can contract tuberculosis. That is extremely false. We are in contact with people whole day, every day. If we have a compromised immune system, we will most definitely contract tuberculosis if we are in the vicinity of somebody that has tuberculosis. You walk into the stores every day, people cough around you every day. But lately, we're all wearing masks because of COVID. So maybe in a way we are safe, but that still doesn't mean we have to not protect ourselves. So how do we prevent TB infection? Education. Education is so important. We have to know what are the symptoms and signs of tuberculosis. And then it's very important when you find somebody in your immediate vicinity, whether it is a fellow educator, a family member, or even a learner, guide them so that they are able to go to their local health professional for rapid diagnosis and treatment. The quicker the germ is diagnosed and treated, the quicker you will prevent anybody from being infected. Now, also bear in mind that you are not contagious from the minute you take your medication. It takes 14 days from the start of taking your treatment, every single day for 14 days before you are no longer infectious. You are still infected with TB, but you're no longer contagious. You can't pass that TB on to somebody else. So when you have a learner in school that comes back after 14 days and says, my 14 days are over, I can come to school, or the mom brings the child to school, you need to not accept that child back into school, or even the educator. What you do need is a note from your healthcare professional that states and clearly states that this individual has been on treatment for the past 14 days. And on day 15, that person is allowed back into school. We have got to follow the recommended treatment guidelines as set out by the healthcare professional. Any person with tuberculosis must be monitored closely, and their response to treatment must be monitored as well. Within the schooling system, it becomes important that the treatment is taken and completed as well. So we're going to get to this part when we say within the schooling system, when it comes to writing your policy. We also within the school have got to implement appropriate administrative and environmental infection control when somebody within our system has tested positive for tuberculosis. Why? Why do we need to do that? Especially when it comes to environmental infection control. If one person in your class is infected with tuberculosis, every child in that class needs to be monitored for a few days to make sure that they too have not contracted the tuberculosis germ. All right. If you have any questions at this point with regard to tuberculosis, please write them down, as I said, for our discussion next week. Let's talk sexually transmitted infections. Now, I want you to think of a few sexually transmitted diseases that you know of. What comes to mind would be things like syphilis, gonorrhea, chlamydia, what else is there? Crabs, etc. But these are just a few of it. There are more than 20 disease-causing organisms and syndromes that are now recognized as belonging within the category of a sexually transmitted infection. STIs are spread by the transfer of organisms from one person to the next. And how? During unprotected sex. During unprotected sex. You can't get it if you are using condoms, can you? Unless, of course, the person uses the same condom with a few people. Yeah, which shouldn't be happening, should it? In addition to the traditional STIs like your syphilis and gonorrhea, the spectrum of STIs also include, and have a look at this, HIV, which causes AIDS if it goes untreated. Chlamydia trachomatis, human papillomavirus, also known as HPV, which can cause cervical, penile, or even anal cancer. Genital herpes and chancroid. Now, STIs remain a public health burden. In 2014, we sat with more than 1 million males and females that were treated for new STIs in that year. More than 1 million. And yet, we have condoms that are freely available at our clinics. In addition to that, more than 1 million, over 300,000 males were treated for male urethral syndrome during that same year. Scary, hey? STIs are a marker of unprotected sex and continue to the transmission of HIV. Do you see how that follows one another? A person can have an STI without even having noticeable symptoms of the disease. So now just imagine somebody with an STI having unprotected sex with multiple partners. He or she are not showing any symptoms. So they're having sex with multiple partners. Those partners, because they are casual partners, are having sex with other partners, and so the ball keeps rolling and rolling. At the end, you have a domino effect. So there the pyramid goes down, and the more people that they have unprotected sex with, the more people are then infected with an STI, which can lead to HIV. which can lead to AIDS if you do not get tested and start a treatment in soon enough time. This is scary, isn't it? Very much so. All right. If you have any questions with regard to sexually transmitted diseases, please write them down now so that we can discuss it next week. Let's move on to COVID-19, coronavirus, and the impact of those infected with HIV, AIDS, and tuberculosis. Now, you all know, as you've already been through a COVID-19 awareness program, you all know who are most at risk. You also know how it can be prevented. All right? And then, of course, you also know how COVID-19 is spread. And we all know the symptoms. But let's talk COVID-19 and HIV. Remember, somebody with HIV already has a compromised immune system, a majorly compromised immune system. Somebody with HIV needs to take absolute good care of themselves. Even those with tuberculosis, they need to take extra care of themselves and not be heroes to somebody else and then forget that they have a comorbidity. Because somebody that misses out on the ARV treatment is a surefire way of compromising your immune system to the point where you can contract COVID. Currently, our country is in chaos when it comes to the medical health facilities, etc. So when it comes to somebody infected with HIV or even tuberculosis, make sure that you have enough medication that can last you at least 3 months, up to 90 days. Don't just go for your monthly. Try to get up to 3 months of medication. That way you cover yourself effectively. Take your medication religiously every single day. Do not skip. You skip, when you have a comorbidity and you skip your medication, you leave yourself open to become infected. Now, how do we prevent COVID-19? Can we prevent COVID-19? On a personal level, I am of the opinion that you and you alone can give COVID-19 free entry into your body. And you and only you alone can be the cause that you get COVID-19. Why do I say that? How do you allow a virus to enter your body? By not being safe. By not taking care of yourself. By not putting distance between you and other people on the outside. By not avoiding close contact with people that are sick. Wash your hands as often as possible with warm soap and water. Warm water with soap. For at least 20 seconds. And bearing in mind that you do your fingernails as well. The inside of your hands and fingers, your palms, the top of your hands and fingers, your thumbs, and of course, the one place we always miss is your wristband. The wrist, wash your wrist as well. Even if you use a sanitizer, do the same thing. Only you can prevent you from becoming infected with COVID-19. You need to take care of you. Nobody else is going to do it for you. Take care of you, and you are able to take care of the people around you. Ensure that people in your immediate family and even yourself who have comorbidities, that you do take care of yourself and take your chronic medication religiously, regularly, and on time. Steer clear of people that are infected. Don't be anybody's hero. Be your own hero. COVID-19 is highly contagious and is spread when fluid droplets carry the virus. And some research have indicated that COVID-19 could possibly have mutated already and are now airborne. So we need to remain safe. When you have certain symptoms like coughing or sneezing, do not run to get tested. Do a few tests for yourself to see whether or not you are positive. You can start taking regular vitamins to combat COVID, like you would combat the common cold. Gargle with salt water. Your throat is sore for a day or two, gargle with salt water. If it goes away, then good. It's just a normal cold symptom that you have. And remember, it affects everybody differently. I may have a sore, scratchy throat for a couple of days and it could end up being COVID-19. You could suffer loss of taste or smell or even diarrhea and constant headaches, but you don't even have a sore throat. But you have to monitor yourself for a period of a few days to see whether or not you could possibly be infected with COVID-19. And if you are, you take every precautionary measure to get better. You need to self-isolate or quarantine, then do so. Try as far as you can to remain and stay away from people who you can infect. If you have any questions on COVID-19 at this point, please write them down for discussion next week. Let's move on. There's global recognition of the crucial role of the Department of Basic Education in prevention and management of HIV, STIs, and tuberculosis. Now, we all know that HIV has not been managed successfully in South Africa over the last 2-3 decades. STIs, even that, have not been managed successfully. And then we look at tuberculosis. That is even another pandemic that has not been managed effectively. So it is the responsibility of all those within the education department to start looking at how we can put preventative measures in place, because all of these have also been the direct result of us losing learners to the outside world and never completing their mainstream scholastic education. The Department of Education, Basic Education, has been guided by key government and departmental seminal documents. And these documents include the National Development Plan, the National Strategic Plan for HIV, STIs, and Tuberculosis for 2017 to 2022, the National Youth Policy of 2015 to 2020, the Department of Basic Education's policy on HIV, STIs, and tuberculosis, and then lastly, the CASTLE program, which is the care and support for teaching and learning. I want you to understand that this is not just another project. This is a paradigm shift for all within the education sector. Every school needs either a revised or a brand new HIV, STI, and tuberculosis policy. And remember in the beginning what I said? Your prejudices need to be left behind. If you have any issue with regard to any of the topics we've discussed so far, HIV, STIs, and tuberculosis, you need to remain open-minded. Because if the Department of Basic Education says to you that you need to make condoms available at your school, what do? We all stand up and say, oh, hell no, we're not doing that. There is no way we're making condoms available at schools, because that would be like telling the children, yeah, here's a condom, go and have sex. But I want us to think differently about this. I want us to look at the flip side of the coin. By giving somebody, a youngster that is sexually active, a condom, and provide him or her with the necessary information attached to it, you allowing them firstly to go out there and make an informed choice, an informed decision on whether or not they want to have sex. Secondly, by them deciding to have sex and then having the condom with them and using that condom, you now prevent a possible STI, you prevent a possible HIV infection, and you prevent a possible pregnancy. We need to not look at things as they are. We need to look at the bigger picture. We need to flip that coin around and look at how we can look at things differently, how we can look at things from different angles to allow these youngsters to make informed choices and decisions. I have said a lot at this point, and I think we're going to stop here with video 1. Video 2, we will continue where we will discuss the difference between the 1999 and 2017 HIV policy. Because in terms of the 99 policy, nobody looked at the infected or affected learner. Those were not the ones that were protected within that policy. So we will iron that out when we get to our video number 2. So if you have all your questions, we're not going to deal with it in video 2. Video 2, we'll deal with your HIV policy for 2019 versus 2017. And then we're going to look at something that's very important. And that is the LGBTQIA community. A lot of people do not know what each one of those letters stand for. So we'll be covering the HIV policy content. We'll be covering LGBTQIA. And then we're going to look at what drives our policy. We're going to look at the guiding principles as well as the policy themes. All right. I know we've said a lot and we've been busy for quite a bit. So let's take a break before we move on to our next session. I'll see you guys in a moment.